we have John Sweeney, and John is going to talk to us about promoting quality and standards in care. And John has, and obviously from what's been said earlier, this area of quality and standards is a critically important one. John has a long history in this area, from very varied as well, from working as quality coordinator in the University Hospital Galway to currently being the advisor to the Supreme Council for Health and Qatar. God, it sounds very exotic. He was previously director of the Irish Society of Quality and Safety in Healthcare, and he's now a board member. So I think John was very well qualified to talk to us. Yeah, I'll give you now 3 minutes to go before 20 minutes.
I appreciate that.
Okay, thanks very much.
Good morning, ladies and gentlemen. I might move around a little bit just more to keep warm than anything else. Anyways, it's great to get the opportunity to speak with you this morning, especially on a Friday morning. I always find it's a little bit easier than any other morning. Of course, coming up to the coffee break, it's a little more difficult. However, it's often an opportunity we get to talk with groups from different types of organizations about the catch-all phrase of quality standards and what it's about. And in home care, we're certainly lucky to be involved with organizations which profess that profound belief in the need for quality and improvement of care that we provide. We've heard a lot of numbers already this morning, big figures, billions of contracts. I'm going to bring it down to a little bit more smaller numbers. The first number is 53. We had a look at our overlay on Google to see how many home care organizations are actually available to us. And Google said the magic number is 53. Good number. Out of those 53, 20 of the organizations, this is in Ireland, had their mission statement delivered on the website. We had to look at those mission statements. And there was an obvious belief in the quality and the need for high level of services and quality of life within those organizations. They're a sample of individual parts of different mission statements, the commitment to the highest standard of care, enhancing the lives, home care of the highest quality, dedicated to overall improvement of your quality of life, striving to provide the best. And my favorite, down the back, unmatchable quality of home care. I'm sure some people were trying to go that. However, that was where they said they were going. Now, out of those organizations, we also identified that 14 of the home care providers were members of Home and Community Care Ireland, which of course is a mission statement to foster and promote high quality home care services. We're all traveling on the right track. It's all going well. Again, out of that subset, out of that group of 54, we could identify that there were 8 organizations that went that step further. They had identified specific and achieved specific quality certification, either ISO 9000 or the QMAR. Now, unfortunately, one of the difficulties, and where it's always good to see an organization going down those routes, ISO 9000 and the QMAR are industry generic. We have also similar certifications for shopping centres, for laboratories, etc. So it designs and supports systems for the business to operate, which in itself is certainly a good thing. But yet, with all of that commitment, with all of that focus, there was only one home care provider in Ireland that had demonstrably identified and displayed itself with regards to the quality of care. Only one home care organization in the entire country sought external, independent assurance that the quality of care that it was providing was appropriate. And that was VHI Home Care, that JCI accreditation last year. That in itself is questionable about where we are. The JCI standards, my own organization we partner with, are an organization that provides accreditation across all different areas. In Ireland, you'll see it quite a lot in the private hospital sector, the Blackrock Clinic, Matter Private, Global Clinic, Bon Secours Hospitals, ambulance services, long-term care services, etc. It's a voluntary process to undergo international recognition of the quality of care that we provide. That's the big thing. Not how good our business is, but how good is the care that we're providing. So the question has to be asked, why are there not more? Why is there only one organization that has gone down this route?
It's very expensive.
One of the reasons. When I was speaking with an organization like this before, go back to the cost of it, and I was in full flight in relation to the need for external review and involvement, the need for good quality of standards. And down the back I got, well now, that sounds like astronaut licenses, and what we need are driving licenses. Because the concept of it, and where the gentleman was coming from, was not unusual in any of the areas. There's been several different areas that have been regulated within the health services over the last 20 years. Although we were well aware of the nursing home regulations, it wasn't the first regulation we brought in. It related to blood banks and EU tissue regulations with regards to tissue banks. And that came from the EU directive. But we've seen a lot of regulation come in, and the challenges that exist are always the same. The challenges are, it is difficult. It is costly. There is no question it is costly. The biggest cost that this involves is the time-consuming aspect in relation to it. And what we find in all cases, and we've worked with maybe 100 different organizations who have gone through some form of external independent evaluation, is that 6 months into that process, the amount of time being sucked away from your core focus of providing care is significant. It is a significant investment in relation to the services that you provide. But the biggest reason that this does not occur is not any of the above. It's because it's optional. The cost in relation to implementing the likes of JCI standards or any voluntary accreditation standard is not significantly different than to when regulation occurs, because the core costs are that development of your system. In fact, you can often see that the external aspect of the survey aspect of it is less from a voluntary process than a regulatory process. But we still have that commitment, and we still need that amount of involvement within an organization. So currently we're in a scenario where home care is rapidly increasing very often. We have a continued demand for home care quality, but we're not in a position to be able to put our hand up and say, yes, you can count on the quality that we provide. But we all profess to it. Now, earlier on at the outset, Sarah made reference to the introduction of regulation, and I believe on the radio this morning with there was a lot of discussion about the need for regulation in home care, and the difficulties that occurs with the amount of time it takes to get legislation through, etc. And that is true, and I'll talk about that in a minute. However, we've seen a different form of regulation, independent external evaluations of services occur literally overnight, with no legislation required, with a significant increase in the quality of care provided. And that is very simply by the payer saying, if you do not have an identified quality accreditation, you do not get funding. VHI Healthcare has been doing that since 1999 with the private hospital sector. VHI commenced that last year with the private ambulance sector. Compliance rate? Price point 100%. So there is independent external evaluation information. Obviously, we've seen when it starts to come from a regulatory point of view, when we have that legislation in place, through the likes of HICWA, and it's not only HICWA, we've got the Medicines Board, etc., we see a massive change in the environment. And in all of the bodies that have undergone that, we see the same backlash at the outset. This is too difficult. This is too costly. You have got this wrong. And some of those arguments are valid. But the most important thing we've seen is huge improvement in the care provided. We've had the opportunity to work with a few different home care providers in smaller different ways. And the challenges that exist in all home care providers are very similar, and it's a challenge of working with behaviour. But in all cases, the identified areas for improvement of care were massive. And those are challenges that you know that exist within your own company. From a regulatory point of view, we're getting regulation. And I know the timescales are something that we're fighting, but it is coming down the track. We see that home care has increased its regulatory impact across the world. With the International Society for Quality in Healthcare, which is the accreditor's accreditor, we have identified that there's a 12% increase internationally in the amount of bodies that are now regulating home care. We see home care across the way in England, Scotland, and Wales, and in Northern Ireland. We see that focus coming out through the international areas as well, increased emphasis in the aging care sector on home care. And that was previously very much in residential care. We see that move, the demanding of the quality of care moving into different areas as we have seen. So the regulation is coming down the line. We do know that it is on the flight plan for the Health Information and Quality Authority. I would agree with Sarah. I don't believe it will be on the line terms of government. However, those things change very quickly. And focus and emphasis can be very reactionary. That's always what's working. And when it does happen, it tends to move quite well. Already, what HICWA have said is that home care will come under the responsibility of the authority, and it will use the Safer Better Care standards. So if you've ever looked at the Safer Better Care standards, there's a lot of information in there, which already tells you this is the way regulation in all sectors is going to work. This is what is important. Once the regulation arrives, it's essentially taking that framework and making it specific to each area, such as home care. So we're going to see a lot of change in it. And if you are wondering, well, what type of measurable elements are they going to be looking at when it comes to regulation? Take a look at the Joint Commission accreditation standards for home care. Because we have looked at all of these, and they're not across. International standards don't vary hugely. We already know what are the core aspects. What's important in providing care? There are international principles of relation. So it's not a case where we have to say, well, we're sitting here waiting to change the way we do things when the watchdog appears. Now is the time for organizations to say, well, it's coming down the track. Let's take what we know will be looked at. Let's take what is best practice and see how we can lay that flight plan down for ourselves in a time frame that relates to it. The Safer Better Care standards from the Health Information and Quality Authority are broken into two halves. First half looking at how we deal with the individuals, how we deal with the clients, the patients, the residents, whatever term you want to use. Whether it's the safety, whether it's the focus. And one of the key findings we've found nationally and internationally in relation to home care is poor to inappropriate assessment of the needs of the individuals that we are caring for. And that is irrelevant of whether it's a health or a social care model. Do we fully understand it, and are we detailing what our plans are in relation? So the first aspect of that person-centered care, and there was discussions in relation to that already, links very much with whether it's effective, whether it's safe. And then the bottom half of the circle talks about us as an individual, our organizations, and what can we do about it to make sure that this comes into effect. So the guidance is there, the principles are there. They're not specific to each service level. There's a huge amount of information which can provide us with an opportunity to put these frameworks in place to be able to provide. The Joint Commission International in Ireland is the only other home care specific standards that exist currently. There are other ones internationally. It's not the case that they have a monopoly on the scenario. And it does talk about patients, but that is a generic term that's used to cover vast and different areas. But again, if you take these standards, and we have copies of them there available, you start to look at the nuts and bolts of what is important. What will look at the best care that we can provide, and what will help us provide a better service to our clients and a better organization. And that's the one correlation we keep saying. It does not matter what service we're in. If organizations are working and striving to provide the absolute best care, not just saying they are, working towards it, they are the best organizations. They are the ones that are successful. They are the ones that are strong. The consistency in that investment. Again, when we look at the JCI standards, no more than the HICMA framework, they're split into two halves. That about the individual as a client and the organization that we need to look at. Whether it's from staff qualifications or whether it's from the governance and leadership. In all of the areas that have been regulated to date, there has only been one problem ever found. Doesn't matter whether it's a university hospital or nursing home. Only one problem. Let's go. The organization is not clearly structured, not clearly led, is not clearly identified the roles and responsibilities. If that is wrong, and after 3 years of research by NUIG on the hospital accreditation program years ago, the key correlation was that we could identify positive or negative clinical outcomes depending on the scores for the governance standard. So if you're only look at one of the set of standards, that's where the governance starts from. So for organizations that go through this, what are the outcomes? Well, the outcomes are they all find it exceedingly difficult. They all find it exceedingly costly. But implemented correctly, they all find it exceedingly efficient. And regulation, when it does come about in relation to the home care sector, what you will find is that there will be a 10% reduction in the number of bodies providing services. How do we know that? Because that 10% figure is almost consistent across all regulated environments. That may be due to the owner organization deciding that it's too much of an investment, it's something that they have to reduce, they're not fit for purpose, or it may be the regulatory bodies themselves actually bringing it about in relation to it. So when we start to look at those organizations, it is something that we have to say, well, what are we going to find the benefit from? And the benefits are to the patient and to the organization. And the findings are through governance, through incorrect communication, lack of clarity, and inappropriate assessments of care planning above all else irrelation. I have no doubt that the organizations that we did see the mission statement that are professing that believe it and believe it at their heart. But regulation is going to change that focus. No matter whether it's 2 years, 3 years, or 4 years, home care will be regulated. But it is not something that we should be waiting for, because you will have a whole pile of difficulties coming after the new time. If you truly profess what you believe, take the opportunity to start working through the HICMA framework, start working, utilizing, define home care standards, and be able to stand up and say, yes, we above all else are committed and dedicated. We want to provide the best care that we possibly can. It is difficult, it is costly, but we are asking organizations to take that step, to move forward, to try and shoot for the moon. Sometimes you do shoot for the moon, you might hit the stars. But what's more important is that you will have put things in place that will make you a better organization and in a much better position for when regulation happens.
Thanks very much, John. And obviously it's, I guess, uncomfortable listening if just one of 53 healthcare organisations has external independent standards and accreditation